This is Crohn's and Colitis Awareness Month. Joining us this morning, Dr. Eric Benchimol is here. He's a pediatric gastroenterologist. Did I get that right?
You got that right.
Woo!
Perfect.
Also, Andrea Hopkins is here. Andrea, you have Crohn's, is that?
That's correct.
Yeah. And for your, you're growing up, your life, you've had this sort of thing, or?
I was diagnosed when I was doing my undergrad at the University of Ottawa, so since my early 20s.
Yikes.
Yeah.
That's not fun to deal with, eh?
No.
Not a lot of fun at all.
No.
No, and you're seeing more and more of this, doctor, in young children?
Yeah, the rates are rising in Canada, in kids under 10 years old especially.
Wow. We're seeing more and more of these cases in Canada, and I don't know, like we were talking earlier, I don't know if it's because we pay more attention to it, but you seem to think it's got something to do with northern climates and northern countries?
Well,
or?
it's one of the theories that's out there. It seems like northern countries and certainly westernized nations, Western Europe and North America, have higher rates than other places in the world. So there's something environmental, something in our environment that's triggering people who have genetic predisposition.
Right. What's it like, Andrea, to as a young woman, to go through this? Like, how does it affect your day?
In a lot of ways, somebody who met me on the street or in a casual conversation wouldn't know.
I would never know unless you told me, right?
Because it has to do with a lot of things that most people don't talk about, going to the bathroom.
Yeah.
So, I mean, in terms of day-to-day kind of management, you're never not thinking about it. Every time I leave the house, you're kind of wondering what route you're taking.
Yeah.
Make sure that you know where the Tim Hortons are and things like that, because they always have nice bathrooms, so you're constantly watching for things like that.
Yeah.
For travel, you have to make sure you can bring your meds with you if you've got the right equipment. You have to manage your medications and your doctor's visits and things like that. So.
Is it different for different people, or is this a classic case of Crohn's?
So I think it's different for different people. Some people have more mild course, but many people struggle with finding a washroom and the feeling of urgency very often.
Yeah.
And certainly it's different for kids. Little kids have to deal with things like chronic abdominal pain, chronic diarrhea, psychosocial issues in the family when a child has chronic disease.
Is that right?
Big deal. And then things like growth failure, so they're not as tall as other kids if their disease is out of control.
Yeah.
Or osteoporosis, their bones are thinner because we develop our bones in teenage years.
Is that right?
Yeah, they get osteoporosis quite early. So, these are all the things that we're trying to manage and prevent these complications from the disease while allowing the child to live a normal life if possible.
Yeah, there's been studies that have been done on inflammatory bowel disease, IBD, and Crohn's and colitis, and it's costing an estimated $2.8 billion a year in Canada.
Yeah, so about 1.2 is what we call direct medical costs, things like physician visits, hospitalizations, and medications are becoming more and more expensive.
Right?
They're more effective, but they're certainly more expensive than they were.
A lot of medications for you?
Well, there's a certain level of medications that's proved very successful in treating both Crohn's disease and colitis. But I think the average cost to the patient and their private insurance is something about $50,000 to $60,000 a year.
Right.
So, I mean,
that's impacted you.
We're seeing less hospitalizations, which is great, but the cost is kind of being transferred now to the patient and their insurance carrier because you're doing this out of hospital now.
Yeah.
But
and it's a constant, right?
Exactly.
It's not something that's treatable and goes away.
But as someone who spent almost 3 months in hospital in 2008, I'd prefer to get my medication outside.
I bet.
Yeah.
I bet. Are we getting anywhere with this?
We are. I think the outcomes are getting better in Canada. Surgical rates have gone down, so we used to have to take out pieces of bowel more frequently than we are now.
Yeah.
And that's probably because of the newer medication.
I just had a friend who went through that, and that's
it's a big deal, and it's expensive to do the surgery and to stay in hospital. But those are going down. They're not zero, obviously, but the rates are decreasing probably because of the newer medications, and because we're understanding more about the disease, diagnosing it earlier, and try to get a handle on things earlier.
We do pretty good around here with events aimed at raising money and so on. We have one on Thursday night.
That's right.
Martini Madness over at Lagos, so people can still get tickets for that. It's going to be a fun night. There's lots of good things going on, including a live auction. I'm going to be emceeing it, and you're going to be there.
Yep.
So hopefully that goes well. But listen, thanks for sharing your story and the information, because I think it's important to understand that this is one of the places in the world where, for some reason, these diseases are quite prevalent. So we got to continue to work on that.
Yep.
Thanks a lot.
Thank you very much.
Thank you.
Appreciate it.